All right, today we're going to do a quick presentation on otitis externa, which is called swimmer's ear. The chief complaint almost always is ear drainage. So you'll go into the exam room and the parent will let you know that they've noticed some ear drainage coming out of their kiddo's ear. They'll often describe it as yellow or foul smelling. And sometimes it will be accompanied with ear pain. Sometimes there's no associated pain. It really kind of just depends. Oftentimes, kids will say that they hear a muffled sound or they can't hear as well from that ear that's infected. And when obtaining a history, typically kids will have had some swimming or water exposure, hang out in the pool, going to the beach, that type of thing. Or they will have recently been treated with oral antibiotics for acute otitis media. So that's your history. Moving on to your physical exam, I typically start out by palpating the auricle and the tragus just to kind of get an idea of whether there's tenderness there. So sometimes you see that, sometimes you don't. It really just depends. With the otoscope, you'll often see a swollen auditory canal with purulent drainage within that canal. Sometimes it is so swollen that you actually are unable to visualize the tympanic membrane. Sometimes there's extremely very little or very little swelling at all. Sometimes you'll see, significant redness to the auditory canal and no swelling with a little bit of drainage, kind of like a combo. So sometimes you'll see swelling, sometimes you won't. Purulent drainage, almost always noted. Sometimes if you're able to visualize the canal, the canal may be a little bit red. Sometimes you can see the tympanic membrane, sometimes you cannot. Sometimes you can see the tympanic membrane and see that there is, bulging or retraction or fluid behind, the TM, and you can make a co-diagnosis of acute otitis media. So those are your cues in terms of physical examination. Causes of swimmer's ear are typically there's two culprits listed here: Pseudomonas aeruginosa and Staphylococcus aureus. I have read that there can be sometimes a fungal component, which we'll get into here in a bit in terms of cultures. You see it a lot during the summertime because that's when kids are having fun swimming, and common in all age groups, but most common between the ages of 5 and 9. So diagnosis is typically made clinically based on your history and physical. You often don't need to do any type of cultures. You will just treat empirically. However, sometimes you will want to consider a culture if this is becoming a reoccurrent problem. So they've been into the clinic multiple times within the last few weeks for ear drainage that isn't responding to the topical otic ear drops. So that is something to consider, but on typical presentation, you do not need to do cultures. Differentials include ear trauma, acute otitis media with perforation of the eardrum, contact dermatitis, cholesteatomas are common. And just to touch briefly on the contact dermatitis, sometimes when kiddos are introduced to new body washes or shampoos, when they're showering and bathing, that can actually cause irritation into the auditory canal. So, that's definitely a differential that should be listed. All right, treatment, pretty simple. You'll start out with some antibiotic ear drops. I typically go with ofloxacin. That's just what I prefer. Occasionally, if I have a child who has extreme swelling in their ear canals, I will then order Ciprodex, which is ciprofloxacin and dexamethasone ear drops. However, that medication can be pretty expensive and sometimes isn't covered by insurance. So just keep that in mind if that's the route you go. In terms of education, I recommend avoiding fully, submerging the head and ears in water for at least 7 to 10 days, which really bums kids out in the summer. So, judgment-wise with the parents, they can hang out in the pool a little bit, get their toes wet, their legs wet, but in terms of like diving and playing hard, I recommend not doing that for at least 7 to 10 days. They can still take brief showers, wash their hair, of course. For pain management, they can take dose-appropriate acetaminophen or ibuprofen. I typically don't have kiddos follow up unless they are not responding to the ear drops. So my spiel with that is if there's still ear drainage after 7 days of treatment, come back to the clinic so we can take another look-see. Prevention for swimmer's ear includes homeopathic ear drops or wearing earplugs when swimming. In terms of like prevention ear drops, I usually will recommend equal parts vinegar and rubbing alcohol. So I have a parent mix that into a bottle and then they can apply a couple drops into the ears and then kind of have them swish it out after they're done swimming or going to the beach. And sometimes that does help prevent otitis externa. Here's a handy dandy little patient handout in regards to swimmer's ear if your parents want that. And here is my reference through up to date, as well as just my own clinical knowledge from clinic. So pretty short, pretty simple, pretty easy diagnosis. Hope you found this helpful. Let me know if you have any questions and have a great day.